Capitol Report is a production of Senate Media Services.
We get to the heart of concerns over H1N1, different visions to providing health care coverage, and Minnesota students could soon race to the top. Details in Capitol Report. Hello everyone, welcome to Capitol Report. I'm Julie Bartkey. Governor Tim Pawlenty continues to move forward with his vision for health care reform. This as nurses organize a rally at the Capitol to protest his cut of the General Assistance Medical Care Program. John Brune details the message coming from the governor and his administration and from those impacted by the GAMC cuts, delivering their message right to the governor's door.
The governor's health care reform initiative would give Minnesotans more choice in the marketplace by giving them the opportunity to buy health insurance across state lines. The plan would require cost and quality-based services from medical assistants and Minnesota Care, and would also include consumer-driven incentives in Minnesota Care. The governor summed up his initiative this way.
Underlying all of this is this principle, that individuals and purchasers have to have some incentive to use money wisely, and we want to create incentives for them to migrate their decision-making towards better quality providers and more efficient providers. The current system is a Wild West system where individuals have really no incentive as to how they use it, as to cost or quality, and the costs that we have from the state and from the government are running out of control. So we've got these publicly subsidized health insurance programs that we have to rein in.
Commissioner of Human Services Cal Ludeman spoke of the need for innovation and future savings in medical assistance.
We oftentimes on reform forget to talk about MA. This is where 550,000 Minnesotans are covered. These are disabled, elderly, or low-income individuals in Minnesota. That's a lot of Minnesotans. That's 12 or 13% of the marketplace that needs to find innovation for these improvements. The cost savings could be substantial, although we're not doing this for any budget purpose for this current biennium, but future savings have to start to show up in MA as well, because those trend lines, as the governor said, whether it's new obligations from the federal government for Medicaid expenditures or even state obligations, these will be hard to catch up unless we get ourselves at least to trend line increases or potentially and hopefully even below.
On another health care front, a nurses' rally earlier in the week brought people together to protest the governor's cuts to the General Assistance Medical Care Program. Protesters traveled throughout the Capitol to express their concerns.
Today we are here to demonstrate our opposition to Governor Pawlenty's outrageous, unethical veto of General Assistance Medical Care.
What happened to me is I was a successful business owner up in Duluth, and I moved down to here. I had a major health crisis, and there was some serious crisis with my business. We ended up losing the house, and we ended up losing the businesses. And what happened is I floundered for about 3 years, and finally I got a place to stay, a place to live. I could actually have a base in which I could, clean, take a shower. I mean, to live a human life again. And at that point I started into dealing with my health issues, and I've rebounded. I just started a new business. I'm on my feet again, and this would have never happened without GAMC.
I am concerned about the hospital that I work in. HCMC really provides, it's a safety net hospital, and we probably get more GAMC patients than a lot of other institutions. It will be devastating to us to have that money gone.
The religious communities in this state recognize that those who are poor are singled out in our sacred texts, but they're singled out for greater care, not for particular harm.
Another healthcare issue dominating the nation is that of H1N1, and medical professionals are reiterating the emergency warning signs that signal the need for immediate medical care. The symptoms to watch for with children include fast breathing or trouble breathing, bluish skin color, not drinking enough fluids, not waking up or interacting, and being so irritable that the child doesn't want to be held. Also, flu-like symptoms improve and then return with fever and a worse cough, and finally a fever with a rash. In adults, you should look for difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting. Here to clarify some of the concerns associated with H1N1, we have the Director of Infectious Diseases, Kristin Ehrseman. Thanks so much for joining us.
You're welcome.
From the Minnesota Department of Health, I should add that as well. Now, we just outlined what H1N1 is. How would you categorize the level of concern with this particular strain, and is most of that concern warranted?
Well, you know, there's sort of two levels of concern. One is the concern that the general public needs to have, and then the other is the concern on the part of the public health community. And I would say for the general public that at this point, just good common sense is sort of what they'll need to address H1N1. Some of the emphasis on 1918 and the severe pandemics is really something that we in the public health community use to make sure that we're prepared to respond to anything. But right now, the way that the H1N1 has presented itself thus far in the first wave and now in this second wave this fall, it really has mimicked seasonal influenza, which is a good thing. We continue to prepare and look ahead thinking there could be a third wave, could it become more severe? Those are all possibilities based on historic pandemics, but at this point we're really pleased because what we're seeing really mimics seasonal influenza.
And a new study warns that H1N1 flu may strike as many as 35% of all Americans. It was a report by the nonprofit group Trust for Americans Health, and it found that hospitals in more than a dozen states could actually run out of beds. Is this a concern here in Minnesota?
Well, I think it's true, you know, anywhere in the country, and the reason for that is that in an attempt to really be more cost effective, hospitals and healthcare have really tried to streamline and, you know, get rid of excess waste. And what that ends up doing is you're kind of just in time, so you don't have a lot of surge capacity. And that's fine most of the time, except when you think about situations like a potential for a pandemic when there could be multiple, you know, folks, many more people than usual that need hospitalization. So I think yes, it is a possibility, but at this point, you know, we have plans in place to manage if there is a need for additional hospital beds more than we have.
And you talked a little bit about the potential surge down the road of another wave of H1N1. Reports do show that through early October, there's actually a downtick in H1N1 in the schools. And so with an outbreak that typically occurs in January or February for flu. So do you think that the vaccine is getting to Minnesota at the right time, or do you think it might be a little too late to give the peak of effectiveness?
Well, actually, I think, you know, part of the reason that I think we're seeing a reduction in cases in the schools, which we think is great, is because there's been really a lot of work on the part of superintendents and school nurses to make sure that kids who are ill stay home, and that helps to reduce transmission. So I think that's playing a role. When people say, well, is it too late to get the vaccine if we've already seen a lot of cases of disease? I don't think so. Pandemics typically have multiple waves. We're in the second wave. There could be a third wave. So I think that both the potential for a third wave means that it's still valuable to be vaccinated. And then the other thing is, even though we have a lot of transmission going on, and even though we have schools that are reporting, you know, absences, not everyone in the school is developing illness. And so the vaccine is going to be beneficial for all those individuals who haven't developed illness.
And let's talk a little bit more about the vaccines. They're starting to come into Minnesota. When do we expect the majority of the vaccinations to be here, and who should get vaccinated?
Well, you know, right now it's a little bit frustrating because the vaccine is coming, but it's coming in such a trickle that we're not able to really, you know, open things up to everyone for whom vaccine is recommended. But our hope is that by early November, early to mid-November, we should be able to reach out to the targeted groups more broadly, if you will. And the people for whom vaccine is recommended are pregnant women, 6-month-olds through 24-year-olds, individuals who are 25 through 64 who have a high-risk condition like asthma, heart disease, diabetes, that kind of thing. For infants less than 6 months of age, they're too young to be vaccinated, so we want to vaccinate their household contacts and their caregivers. And then healthcare workers are the other group that we want to vaccinate. And right now, that's the group we've targeted first with their very first doses.
Okay. Now, a recent Harvard University poll, respondents who were eligible for the vaccine, a majority of them said they probably weren't going to get immunized against H1N1, saying that they were more concerned about the potential side effects from the vaccine. Others said they didn't think that the H1N1 virus would make them very sick if they did contract it. With the vaccine starting to trickle in, what is the message that you want to send to those who aren't eligible for it?
Well, we obviously think the vaccine is a good idea, and I think for people who have concerns about, well, it's a new vaccine and is it really safe and should I get it, I want to emphasize again that this vaccine is manufactured with the very same processes that our seasonal influenza vaccine is. It's been licensed by the FDA. So in essence, it's just like a different seasonal influenza vaccine. The only thing that is different is just the seed strain, which is H1N1 this time as opposed to the other strains. So although we call it, novel H1N1, the vaccine itself is actually manufactured in the same way that all of the other seasonal vaccines have been manufactured. So it goes through all the same safety processes, all of those kinds of things.
We're almost out of time, but you've been with the Department of Health, you said, for about 20 years. Are you surprised at all by how many questions there are surrounding H1N1?
No, not at all. Anytime there's something new like this that there's a lot of media attention to, sometimes it's hard to keep everything straight, so we're not surprised, and we're happy to answer people's questions.
Kristin Ehrseman, thanks so much for your time.
Sure, thank you.
Three of Minnesota's leading healthcare legislators are making an impact at the federal level. Representatives Tom Huntley and Aaron Murphy, along with State Senator Linda Bergwin, returned from 2 days of meetings in Washington, D.C., serving on the Minnesota White House Working Group, giving and gaining perspective on national reform initiatives.
No one out there wanted to disrupt what's working in Minnesota. So whether it's our measurement of quality, whether it's our incentives for changing the payment system, everyone out there wanted what they're doing in Washington to work with us and to complement it rather than to disrupt it or replace it.
A recent legislative hearing provided details on an initiative by the Obama administration. Race to the Top was introduced at a federal level last June, and now the state is in the process of identifying how Minnesotans can benefit from the program. Here to give some more details on Race to the Top, we have the Commissioner of Education, Alice Seagren. Thanks so much for joining us.
It's my pleasure.
Let's talk about the Obama administration's plan. There are 4 different principles in it, but really the idea behind it is to close the achievement gap and get more students to graduate. What do you like about the plan?
Well, I think that the 4 guidance principles really align well with Minnesota. We have already, if you look at the guidance principles, implemented a lot of the things that they are asking states to do. So I think we're in a really good position for this application for the Race to the Top funds. I like the fact that they want bold reform, that they don't want any more excuses with closing the achievement gap. And we have been working on a number of issues that we just have not been able to quite scale up. So this is going to give us an opportunity to do just that.
What are some of those examples of the issues that you weren't able to, as you said, scale
up? In fact, with the turnaround schools, really looking at strategies such as Summer to Success. We talked about how can we implement a really intensive summer school program for students that are behind, say in 5th grade or 8th grade. Really get them to school for 6 to 8 more weeks of school, really intensive, focused on math and reading. And so those are just a few of the examples. Really getting much more engaged with the schools that have not been improving for 5 years. How do we turn them around? What are the things we can do? We know that principal leadership is very important, and we have a principal institute that's been established. But we've been struggling with funding, so this is going to give us a chance for 4 years to be able to really retrain a lot of our principals in being instructional leaders.
There was some concern by Senator Chris Gerlach that this could be just another set of federal mandates, and do we really want to go down that road again? What are your thoughts to his words?
Well, certainly I think that that's a good question. I mean, if it becomes too restrictive or too bureaucratic, we want to consider that. But when you look at the 4 guidance principles, they are so aligned with what we want to do in Minnesota anyway and what we are doing, that to me it doesn't seem to be something that we should be afraid of. We've got good, strong standards. That's what they're requesting us to have. We have great assessments. We have good assessments. And we're doing a lot of things around teacher performance, the QComp program, pay for performance, and evaluation. They're requiring evaluation for all teachers. So we have a lot of things that we're already doing. Our longitudinal data system is almost ready to go. So I think we can really meet a lot of the expectations.
It's fair to say, given the tone in which you're speaking, that you're a fan of most of this proposal. How did you feel when the Bush administration proposed No Child Left Behind? Because in essence, the idea was the same. It was to try to close the achievement gap. So what are your thoughts here compared with that plan?
Well, when you look at No Child Left Behind, I think what it did was elevate the right of a child who was behind academically to be served much more efficiently and effectively than they had been in the past. So it became kind of the new civil rights mantra, if you will, for children. And so the principle behind it, leave no child behind, was really solid and strong. Then we also had to have more transparency and set goals for each child, which we had not done in the past. So I really supported those principles and the fact that we needed to be accountable for every child, not just let them kind of slide through school, through 12th grade, graduate them, and really not have them up to even an 8th grade level of achievement. So that's where I think that started the whole discussion. Some of the implementation, some of the rules and regulations became unwieldy and unfair. So we've had a lot of discussion about that side of No Child Left Behind. But if you take the principles of No Child Left Behind and then you start to look at the kind of the guidance principles and how we can implement this in even a more effective way, I think then you're putting both of those ideas or those proposals together, and I think you've got some powerful goals and things to do.
And are there any red flags at this point that some of the mandates that are coming down from the federal level might be unwieldy?
Well, I think that the discussion for the department and for the whole state, and that's what we're doing right now, we're going out to all sorts of stakeholders to get their feedback, is are there things that we haven't done that we need to be doing for Race to the Top, and how would we craft that for our state to make it palatable? For example, alternative teacher licensure is one that has been resisted. We have certainly advanced it over the last 4 years, but it hasn't gotten legs, if you will, in the legislature. So that's one area that we'll probably grapple with. Looking at teacher evaluation would be another one, but I think we'll be able to come together on some really good ways of doing that. So I think it's just an opportunity to really bring people together and thoughtfully think about what are the things we need to do for the state of Minnesota.
I wanted to ask you real quickly your thoughts to these words as well. At a leadership summit recently, former Speaker of the House Dave Jennings brought up a point that he believes many studies show educational achievement gaps are tied to race, where he contends they are more related to poverty. Given those words, do you think perhaps the state is approaching closing the achievement gap in the best possible way, or are we missing the mark?
Well, I think that certainly there are children that come to school with less readiness, and that can be because of their background and their family situation, poverty, or whatever the issues are. But we have schools all over the country that beat the odds every day with those children that are in poverty. They take them where they're at, and they look at those children and they say, you can do this, we have belief in you. You have the ability to do it, and we're going to take you as far as you would like to go. So we have examples all over the country, and that's what we're going to replicate here in Minnesota. We want to be able to beat those odds.
Do you think you'll be able to get some of this early grant money, or do you think, as the federal level Secretary of Education Arne Duncan said, states have 2 chances to win. They have plenty of time to learn from the first round winners, change laws where necessary, and build partnerships with all key stakeholders and advance bold and creative reforms. Will Minnesota be in that first tier or that second tier?
We're going to go for we're going to go for phase 1. If we don't get it in phase 1, we'll do phase 2. But we've actually been one of 15 states that were selected by the Gates Foundation to be helped. They've given us a gift, if you will, of quite a lot of money to hire a consultant to help us do this work. And it came at a perfect time because, of course, our budgets have been constrained and tightened, and so we have not had as much staff to be able to do all of this work. So we've got this wonderful Gates Foundation gift, and we're using that money very wisely to build our stakeholder support and build our plan.
And when do you hope to have some money in place?
Well, the timeline is March, where they would do the first awarding, and then I think it would be September of 2011, or no, 2010, that you would get the second phase.
Okay, we'll follow that, of course, closely. Commissioner Seagren, thanks for joining us.
You're welcome.
Here to give her perspective on closing that achievement gap, we have Senator Patricia Torres Ray. Thanks so much for joining us today.
Thank you. I'm delighted to be here.
I want to begin with last week's legislative hearing. Now, you were very passionate about trying to close this achievement gap for students, and you were very dissatisfied with the rate in which it is being closed. So what are some of the recommendations that you have that you would like the Department of Education to take to try to close this achievement gap?
I think that Minnesota really has not done a thorough review of the issues affecting children of color in the different districts. And I think that that needs to be done. We've talked about the indicators. We know, the statistics on graduation rates. We know that children of color do not come prepared to kindergarten. So we know a lot of things in general about kind of why children, we know the statistics. We know that children don't come prepared. We know that children are not graduating, but we have not really done an extensive review of what are the possible reasons for why these children are not coming prepared. We are not really studying closely why is that only 39% of American Indian children are graduating. The statistics are just terrible for Minnesota for children of color, as I said during that hearing. And we know that, but we have not spent any resources or time looking into why we have the statistics we have in Minnesota and what is that we can be doing. We began that process about 2 years ago when the Senate formed an Achievement Gap Committee and began to look into those areas, but we ran out of time, and I introduced some legislation that was supported by many people in the state of Minnesota, but our education policy bill was vetoed by the governor.
You had also made some suggestions to Commissioner Seagren on perhaps changing some of the people who are on the different councils or who collaborate with the Department of Education. And you said you had some names. So are you proposing to take a more active step in perhaps getting the right people on board to close this achievement gap?
Absolutely, absolutely. I think that we have some very interesting scientists, people who have done extensive studies on this issue. Here in Minnesota and outside of Minnesota, we have, Harvard University, Dr. Ferguson has done extensive studies on this issue. And Dr. Myers, the Humphrey Institute. We have a number of people that, not just people of color, but, in general, people in the community that have not been invited to have this conversation. So I don't believe that we've had a serious conversation about looking at what is that Minnesota can be doing.
I'd like to read something to you and get your thoughts on this. In a recent hearing at the Leadership Summit, actually last month, former Speaker of the House Dave Jennings brought up a point. He says that many studies show that educational achievement gaps are tied to race, which he contends are more related to poverty than necessarily race. So do you think perhaps the state is approaching this issue in the best possible way? Do you think that perhaps poverty should be included and maybe directed a little more specifically than, say, race?
It's interesting. We are always talking about this, and then what? Is it race? Is it poverty? It really doesn't matter whether it's race or poverty. We really need to look into many factors that affect academic achievement. Poverty certainly is one. How certain children that do not speak the language, children that are of different races, children who live in urban poor communities are being treated in the schools, whether they have access to after-school programs, whether they have access to tutoring, whether they have the support that they need at home. There are many elements that contribute to academic achievement that we need to look at, whether they are connected to race or class or gender. I don't think that's an issue that determines whether or not we pay attention to it, whether or not we take a different direction. I have concluded that it is both. That clearly poverty affects the outcome, and clearly there are some issues related to culture, related to race, related to language that also have a significant impact on academic achievement. Well, let's work on those.
And do you think the Race to the Top initiative by the Obama administration could help close this achievement gap? Do you think that some of those elements can be used specifically for this purpose?
The initiative is designed precisely for that. There are 3 indicators that are clearly incorporated into the Rise to the Top. One is closing the achievement gap. The second one is increasing graduation. The third one is increasing academic achievement. So those are the 3 main indicators to close the achievement gap. So that is what the Obama administration actually wants. That's it. That's what Rise to the Top actually is. So what it is very frustrating for me is to see the state of Minnesota not taking advantage of it. Clearly, from what I heard in last hearing, we haven't invited the scholars and the individuals who have done the research to participate in the process of putting together this proposal. You know, $350 million is significant money to do this work, and Minnesota can do it. I firmly believe in that, but we just need to make an effort.
Senator Torres Ray, we are out of time, but we'd love to invite you back later, maybe closer to session, and talk more about this issue.
I would love to come. Thank you.
The Metro Gang Strike Force is no longer a reality, but the fallout from the actions of some of its members continues to be tracked by legislators. We caught up with the chair of the Senate Judiciary Committee, Mee Mah, to get her inside perspective on what lawmakers hope to gain from the actions of the strike force. Here is a portion of that interview. What kind of information, what is the intent behind these hearings, especially given the fact that the Metro Gang Strike Force is now indeed defunct?
Sure. Well, you know, when the situation broke out, the 5 co-chairs, both the House and the Senate committees with jurisdiction over the Metro Gang Strike Force and public safety, got together. And we identified 2 primary goals for how we're going to very decisively respond to this situation. The one goal is to find out what went wrong and how we can help to prevent it from ever happening again. But the second goal is that we needed to move very quickly in the process of finding out what went wrong and how we repair that. We knew that we had a tremendous amount of public trust to repair and restore to our public safety people on the front line. So as a result of that, we identified 4 main areas that we needed to have further hearings. And the goal, we hope, is that after we've gone through the hearings that we need to do in those 4 areas, that we will have found out what went wrong and take some steps to address that legislatively, but also begin to repair the relationship of the public with our local law enforcement.
And you can view that entire Inside Perspective interview. Just log on to senate.mn/media. And that's going to wrap up this week's Capitol Report from all of us at Senate Media Services. I'm Julie Bartkey. Thanks for watching.